So talking about another one of those areas of the new system not quite as good, in regards to computer literacy and access, Marilyn and Helen have raised questions around the new services being accessed online and what happens if you either don't have access or don't have the skill to use computers. So how do you respond to that, Sharon?
One of the things that we were really pleased about when the government did develop the Carer Gateway was that they did listen to carers, and carers can access services online if they want to, or they can access them face to face. So it's really good that they actually have that option. For those carers who may not be computer literate, and we've definitely found through COVID, there are more carers that actually want to use the computer and be able to connect in a range of different ways, then we'll be looking at what we can provide as an organisation to support those skills for them, but also connecting with other areas like your libraries and your community centres, where they're delivering courses for people so that they can actually get that literacy. That way carers have a choice. They can access some of those services face to face, or they can actually then access them online.
So then, maybe for David, I'm interested to know how you're going to let people know about the Gateway if they don't have online access.
Yeah, I might just jump back really quickly. I think I've got to give government credit here, because they could have easily gone down a path which was a purely online path. It would have been very easy to do that, and during the co-design period we really strongly talked about face-to-face services. So that's a great thing that they continue. They listened to us and did that, so that's a really good thing. We also know people don't have access to not only not digitally literate, or don't know how to use computers. Often people might know how to use a computer, but they don't have the money to get access to, pay for internet service, or pay to actually have the hardware or the computer themselves. So that we know that that's an issue. We know that that's a challenge. So how are we going to make sure if people aren't online, how can they hear about us? Well, hopefully one of the things that we're doing is we're doing some campaigns. We've got one around National Carers Week at the moment, which is around celebrating carers, but that's on the radio, it's in newspapers. So we're looking to do that across the state. So you'll see our phone number splashed around, you'll hear it on the radio, you'll hear ways to access it outside of the online version. But also we have staff on the ground, and one of the things that they will be doing, are doing at the moment and will be doing is doing some community awareness. And so that is going out into community, talking to carers, talking to community groups, going to events, and actually being a person there that you can access and speak to about how you access services. So look, there's also we had, I wouldn't say grand plans, but we had plans to stop our newsletter. That was a hard copy newsletter that went to carers who are registered with us, and look, we had officially had our last newsletter not long ago, but we've heard some pretty strong feedback around carers who don't have access to the online version. How do we still get there? So that we're now working through about how we still provide something in for carers in that way. So we're making sure we're trying to listen, and getting out into community is the answer, hopefully.